My name is Dr. Benjamin Busfield. I'm an orthopedic surgeon practicing in the East Bay. I have offices both in Walnut Creek and Antioch. I am sports medicine fellowship trained, having done a year of training at the Job Orthopedic Clinic in Los Angeles. I'm also double board certified in both sports medicine and orthopedic surgery. I have a practice in the East Bay, specializing in sports medicine, but also in general orthopedics. I always wanted to perform a role of doing orthopedic surgery for my community. Therefore, I do a whole gamut of surgeries to include sports medicine, arthroscopy, joint replacement, fracture care. I do hand and foot surgeries to include carpal tunnel, trigger finger, as well as fractures in both of those areas. I am currently in my 15th year of practice, having spent all of my career except for the first 2 years in the East Bay. I'm also a resident of the East Bay and actually grew up in Benicia. I went to undergraduate studies at UC Davis. I went to Georgetown for my medical school and also got a master's there. I then did my orthopedic training at UC San Francisco and finished with my fellowship at the Job Orthopedic Clinic in Los Angeles. Despite what you may think, orthopedic surgery is not all about surgery. In fact, most of our patients are treated without surgery. There's non-operative care, which would include injections such as steroid injections, viscose supplementation, PRP injections. We also use physical therapy, chiropractic care, home exercise programs to treat a lot of injuries non-operatively. As far as who gets surgery, there are several factors that go into that. It's the patient and their lifestyle and their demands. There's also the injury and any appropriate imaging. There are accepted reasons to have surgery, but it's always going to be up to the patient, of course. My main job as a doctor and surgeon is to teach the patient exactly what their problem is and give them all the alternatives so they can make their own informed decision. That includes both operative and non-operative options. Surgery can be done in several ways. Open surgery or using an incision is typically done for larger surgeries such as joint replacement, also knee replacement. There are surgeries called arthroscopic surgery done through very small incisions using an arthroscope that's about the size of a number 2 pencil. Using that instrument, we can minimize the damage to the soft tissues, gaining little windows of access into the joint of interest to minimize collateral damage and minimize post-operative pain. This hastens recovery and tends to give a patient a more comfortable recovery. Treating patients is in many ways a multidisciplinary approach. It's not just me or my staff, it's also involving other teams that play a role in recovery. After surgery, for example, it is very common to utilize physical therapy. It's also common to have a home exercise program. It is not uncommon to refer to other doctors in the area, be it in my field or in other fields. I tend to refer to neurology and rheumatology when needed, and even to other surgeons in my own field for their appropriate expertise. Not only do I care for you with my own skills, I'm also aware of when I should make a referral to the most appropriate surgeon for whom I know who are the best in the area. The most rewarding part of my job is to see a patient have an excellent recovery. For example, an older patient having difficulty walking, has been having pain for a number of years, failed non-operative care, perhaps using a walker or limited to household ambulation alone. To be able to take that patient, do a surgery, and in 3 to 4 months achieve a maximal outcome where the patient is largely pain-free and has increased their ability to live and do their activities is very rewarding to me. The other person would be a young athlete who's injured themselves, be it an ACL tear or meniscus tear. Being able to take that patient who's injured, turn them around within a several month period of time and get them back to full activity is very rewarding to me as part of my career in making the patient achieve their best possible outcome. I model my practice on the boutique model. I like to have a small setting office space with a handful of known and reliable employees. When you call my office, you tend to get the same people. I like my patients to know my staff. My patients will always see me. I don't have any other partners. I like to have that model, whereas now at this day and time when all medicine is becoming corporate with very large groups becoming impersonal, I try to keep that personal touch using my boutique practice to serve my community. As a community orthopedist, I do treat patients of all ages. That includes children, middle-aged patients, as well as elderly. I do a whole gamut of surgeries, and if it's not in my expertise, I'll make the referral to the appropriate surgeon. As far as seeing me as a patient, PPOs and Medicare do not need referrals. You simply call my office and we're happy to see you. If you have an HMO or a managed Medicare, you will need a referral from your primary care doctor, and that can be arranged by simply requesting a referral to me. I'm Dr. Benjamin Busfield. I look forward to the opportunity of getting you back to the lifestyle you deserve.